we're a relationship-based profession. All of us in healthcare are. We not only provide care to other people, but we also get to know them and learn them. And that's why diversity in nursing workforce is so important, so that our patients and our communities feel comfortable receiving care from us. So I'm Sami King. I'm the Chief Nursing Informatics and Education Officer at Children's National in Washington, D.C. My role in nursing at Children's National Hospital is to oversee nursing education, professional development, the interprofessional stimulation program, as well as nursing informatics, technology, and systems implementation. A diverse nursing workforce looks at inclusivity of race, gender, people of different origins, and what we really want to look at when we think about a diverse nursing workforce is making sure that our workforce is representative of those that we care for. We have diverse patient populations in different pockets of urban and rural environments. We want to make sure that patients that we care for see themselves in the caregivers that provide care to them. When we look at our nursing data, however, we are making improvements in diversity in the nursing workforce, but we're not anywhere near the numbers of the population. About 20% of the nursing workforce is represented by a minority ethnic group. We really need to think about the opportunities to increase the demographics of the nursing workforce to match the needs of the patient populations that we care for. The Conway Nursing Pathway Program is a program that was conceived out of a need to understand what factors would support success for individuals entering nursing and then making sure that they can thrive and stay within nursing. Our Chief Nursing Officer, Linda Talley, partnered with our foundation, our communities, and others within our organization to identify a structure that would enable nursing students to be mentored by nursing staff within Children's National Hospital, to look at a work-study program to give them clinical experiences, and then to also help support and eliminate any student debt or tuition costs that would impede their ability to progress through nursing school. The neat thing about the Conway Nursing Pathway Program is that the mentors are actually also in school. So they're studying in school, and so are the mentees. They can talk about strategies for success when it comes to doing assignments, talk about strategies for success when it comes to taking a test and studying. And then we also do a work-study program. And through that work-study program, the mentees are able to come to Children's during the summer, and they're working alongside a registered nurse. They're getting to really see what it's like in the real world, in the practice-based setting, and they're getting clinical experience. We have to really think about how are we engaging early on in a young person's career path choices in their early education. Are we promoting and giving them pathways to science programs and having them think about careers in healthcare? And that doesn't mean that we can't do that in an incremental way. We can, expose them to other health professional careers, certified nursing assistant, LPN, and help them have a trajectory that helps them become a member of the nursing workforce as a registered nurse. And it can happen over time with the right support, but it also needs to be part of an environment that supports that inclusivity, that diversity, and helps to bring others along and support their success, not just academically, but then as their career unfolds. And we have to really think about our leadership structure. Do they see representation of individuals who look like them in nursing leadership positions? Most of nursing leadership is primarily white females. Do they see someone that they can aspire to be? Some of us go right into nursing school after we finish high school. Others of us take a different pathway. We become certified nursing assistants. We become EMTCs. We become LPNs. And then we progress. And the reason for that is sometimes we have to look at what some might coin as the social determinants of learning or social determinants of education. And what I mean by the social determinants of learning or education is to really understand an individual holistically, to recognize what barriers or what factors may impede their success, and to be able to create an individualized plan or structure for that person to be successful, whether it is getting into a nursing program and then being able to be successful during the coursework and academic progression, as well as to transition successfully into their chosen profession. Transition to practice programs are really vital here. You can teach nursing skills, you can facilitate thinking, you can build relationships, but you really need to think about how you can do all of that together at the same time in a more holistic perspective. We have to think about what are those upstream strategies that will eliminate barriers to entering the nursing workforce for our minority ethnic groups and other diverse populations. What can you specifically do for an individualized plan for a person to be successful, so that the downstream impact is that we have more diversity and a larger available pool of diverse nurses to meet the need of a lack of diversity in nursing faculty, lack of diversity in nursing leadership, and a lack of diversity in the overall nursing workforce. So I think to make a program like the Conway Nursing Pathway Program successful in another organization would require, one, to really look at your stakeholder buy-in. Not just internally from your leadership structure, but also your community partners, to identify individuals within that community who are seeking to pursue a nursing career. I think the last thing is to really understand your structure in terms of your processes, what programs you have to have in place, what resources you need to support that program. Leadership, stakeholder buy-in, foundation or philanthropic support to help support funding if it can't be operationally funded, staff engagement, not just within nursing, but other teams, and then finally really having a strong structure for the program to be successfully implemented and sustainable. We've had a concerted effort to showcase and exemplify nurses from diverse backgrounds within our current work environment to ignite that opportunity for others seeking to be in nursing and to support a diverse nursing workforce. It really does require an all hands on deck effort to actually influence health outcomes, health equity, and improve the health of our communities.